So, migraine is a common and debilitating headache disorder, and it is a neurological brain disorder with an inherited component. So, it means that it's part of your genetic makeup to have this tendency for headaches as well as sensory disturbances. And I try not to use the word headache to describe migraine because it is more than just a headache. So people with migraine will have symptoms of hypersensitivity towards light, sound, smell, and they also develop symptoms that they may not think are associated with their migraine, but are. So things like neck stiffness, concentration difficulties, brain fog, and also mood changes. And even after the pain has gone, people tend to still have this drained and exhaustion that can last for a few days after. So it's really important to understand that migraine is more than just a headache. So migraine is really common. It can affect up to 33% in women and up to 13% in men in their lifetime. So it's so common that it's likely that either you or somebody you know has migraine. It is also one of the top 5 leading causes of disability in the world for people between the ages of 10 and 50. The effects of migraine are often really underestimated by both people who have migraine themselves and people around them. As I described before, the symptoms can be is more than the headache, and so the effects can be unseen by other people as well. In one's lifetime, because migraine is part of your biological makeup, there'll be times where migraine is not as common, and there'll be times where it'll be more bothersome, and that can fluctuate in your life. And it's really important to know that and to understand that condition. The effects of migraine can be great on somebody's personal life, their social life, their professional life, and on their education. So that is why it's so important to have the Migraine Awareness Week. So the term transition is how we describe moving from the children's services to the adult services. And it's really important to recognize that there are differences between the two, the main being that in the adult services, young people will have more independence over managing their own condition. And as I described, migraine is something that is part of their buildup. So it's really important to understand the condition, what they can do to manage it themselves, and also when to seek help. It's been a great opportunity to collaborate with our colleagues at Great Ormond Street, and together we have developed this headache transition clinic for people with chronic migraine and other headache disorders that require specialist input. And it's through this multidisciplinary team approach that we hope to make the transition as smooth as possible for our young people with difficult migraines and headache. So it's been crucial. So once the young person comes to the transition clinic, they then go on to the adult headache services. And it's important because we've been so lucky to have all these experts and world-renowned headache specialists working at King's College Hospital and Guy's and St Thomas's, and everyone's been really collaborative in making this happen, along with the managers across all sites that have been really engaged in making this work. So without the King's Health partners, the transition clinic would not be possible.